Our next speaker is Dr. David Craig. David Craig works for, he's the Chief Medical Officer, David?
Yeah, Medical Director.
Medical Director today, for Spruce Health. Spruce has been a long time Connect partner. Spruce is kind of the dominant solution, direct primary care space that that doctors use to communicate with patients outside of office visits. Right? So one of the magical things about DPC is I can text my doctor, call them, FaceTime them, whatever I want to. The payment model allows for that. I don't force people into office visits because that's how I get paid. Most of primary care doesn't need to be an office visit. Spruce is the platform that all of our clients, most of our clients, if not all of our clients, are using to facilitate that type of care. So with that, Dr. David Craig.
All right, thank you all. A huge thank you to him for having us. It really has been a productive, amazing relationship for a couple of years. We've learned a ton from them and from you, and that's where a lot of the material for this talk comes from. We've been privileged to have a front row seat on taking our communications technologies and seeing what you guys do with them. And that's where I get a lot of this. At this point, over the last 2 years, I've had a lot of conversations with direct care providers and people outside of direct care in how they're using these to motivate things like employer contracts, how they're finding success. I think everyone here is sold on the idea of better communication being great for patient care. I'm an ER doctor. I still practice a shift a week. It's fundamental to what I do. I love doing patient callbacks. It's super great for care. We're sold on that. I think the more interesting stuff is looking at how you guys have been able to leverage it for success in the business side of things, looking at how you're winning these employer contracts. And we keep hearing employer contracts today. It's a hot topic, obviously. It really can take DPC practices to the next level. I'm not going to talk about the best way overall to win those things. I think Jeremy Smith did a great job talking about what a TPA is, how to wrap your stuff in an ACA compliant plan, how to pitch that. What I'm going to do is take a look at a niche part of that. How can you look at just what you're doing with communications and healthcare communications specifically to motivate your employer strategy? And that's what we're going to go through. So about me and disclosures, we kind of covered it. You know, I work for Spruce. I'm a little biased, but I think medical communication is super important, and we spend all day, every day, trying to figure out how we can best own every type of modality, whether it's texting, secure messaging, telemedicine, whatever it is. And I've had about 3 years of involvement with DPC practices now via our relationship with Hint and all of you guys. So the agenda, we're going to spend about 2 seconds talking about the employer types and the alignment between DPC and those employer types, because I think you guys mostly already know that from the other talks. And then what I'm going to do is take you through the triple aim of medicine, which I think we're all aware of too, satisfaction, quality, cost, because that is where there's a giant alignment between what self-funded employers are looking for and what we're all looking for in terms of revolutionizing care. And then we're going to take a quick look through MyMD Connect, who we did a case study with about a year ago, and how they've been able to use Spruce for. But again, it doesn't have to be Spruce. It can be any of these messaging technologies. I just think we do a good job with. So, self-funded versus fully insured. I think you guys have a pretty good grip on this, but the self-funded is the type that's taking on the risk directly, and they're going to be the ones that will listen to you about things like satisfaction, quality, cost, because it's what matters to them. The impact you can deliver there actually is impactful for them. And the key there is that you are aligned with them on all three, forks of that triple aim. You can improve satisfaction. That's something you already wanted to do when you went into DPC before you probably cared about an employer contract at all. Same with quality, and just by the nature of what you're doing, you can decrease costs. So taking each of those one at a time here. There we go. Here's my case for why better medical communication can help you with all three of those. And the way I've tried to structure this is to get you thinking about it, but also to lay out some facts and figures that if you're putting together a pitch deck, you can include these. I don't have the references on here, but there's a thing at the end to download them in the various ebook forms and other things that we've written. So I promise every one of these figures does have a source, and you can find them through me. So first of all, communication and satisfaction. There's a couple really good studies on this. Better medical communication is just better for patient satisfaction. That's the most easy, obvious one, but it's well proven. One of my favorite ones is looking at a study that really looked at risk management episodes for patient communication. 75% of patient complaints relate to communication problems, not care issues. That was surveys of patients that had complaints. And then there's a 6% increase in complaint rate for each 1-point drop out of 5 in satisfaction. And you can see there I stole one of the pivotal graphics right out of the paper. That's different thirds of doctors by satisfaction rating, and then risk management episodes per patient. So this is the type of thing where, patient satisfaction can seem a little touchy-feely. Do I need to care about that? Is that as important as quality metrics or cost metrics? It can be, because it can relate right into cost and other things that are near and dear to everyone's hearts. Communication and satisfaction. We wrote an ebook recently on the way patient preferences and societal preferences for communication are changing. And I found some of the most interesting stuff there. Our CEO, Ray, was getting annoyed that I wasn't doing any other work other than reading every research study on communication written in the last 5 years. Because it's fascinating. We really are at an inflection point of change. Everyone wants to do things like text or use apps instead of these technologies that had a very short moment in the limelight, like email or other things. Those are obviously still important, but there are some giant sea changes going on that are important to be aware of. So again, these are out of the ebook. I don't want to spend tons of time on these, but look at some of these stats. 30% of people no longer bother to listen to their voicemail. I'm sure that's context dependent, but that number came from a large telecom provider that was powering people's voicemails. So they can just look at their data and see that. That's crazy. 82% of people want a way to contact a company other than phone or email. You heard as I was getting on the stage that one of the beauties of DPC is being able to text. It's like it's possible out there. All right, so this is our thesis that you can pitch to employers. In order to have a chance at having satisfaction going forward, you're going to need to embrace more communication modalities and more ways for patients to reach your clinic, and more times, nights, weekends. That means not just supporting texting, but finding a way to make that like a shared inbox for your team, something where it's not just you giving out your personal number, because that's going to be unsustainable at some point. Communication and quality. We know this, DPC knows communication is the bedrock of the patient-physician relationship. It's better communication is going to be better health. There are studies that support that. You're free to use these in anything you want. There are meta-analyses showing a small but significant impact on actual health outcomes. That's the real deal stuff. And then technology, my argument, can improve communication. We're seeing people using our features for scheduled and saved messages in innovative ways. So if you want to check on someone in 2 weeks, you don't have to make a sticky note to send them a text message. Just set a fuse on that message. Again, Spruce is not the only one that's doing this. I don't care what platform you use, but you should come up with something that lets you embrace new ways of making these technologies scalable for you. If you're texting just off your phone and you can't do it through a web interface, rethink that. And then, communication and cost. Again, you guys know, better communication, if you spend more time with someone, I heard someone earlier say, if you let the patient talk long enough, we'll tell you what's wrong. That is true. And if you let them talk long enough, or you're available to check in with them the next day after that, 3 days after that, maybe you can hold off on an expensive imaging study, or even on starting an antibiotic for a while. We all know this. There's the great Q-Lines data. I think I saw some of the Q-Lines people here earlier. Amazing data, showing this cost savings. There's the MyMD Connect data that they were sharing with us. That's fantastic too. And then there's more subtle stuff. If you're keeping people out of office visits, you're saving employees travel time. That's less missed work. There's a study showing that typical outpatient visits at least 37 minutes for just travel time. That's obnoxious. Employers are going to care about that type of thing. And for you, because you're not fee for service, there's no incentive to get them in for that critical face-to-face time for your CPT code stuff. If you can handle it over a text message or FaceTime or whatever it is, it's fantastic. That's direct cost savings and time savings. And then even Medicare now knows this. You can see that. How many of you have heard of these chronic care management codes? It's been around about 2 years now. Yeah, this is a gold mine for fee-for-service practices because they're finally able, if they're smart about it, to bill for chronic care management. And you know what a lot of the criteria are if you read the Medicare documents? It's all the stuff you guys are doing that we've been hearing about for years. It's coordinating community services. It's calling them to ask how they're doing. It's all the stuff that you probably spent years not getting reimbursed for in fee-for-service. Well, now Medicare's got a path to it, and they're not dummies. They're doing it because it pays. Look at that stat. 14% of Medicare enrollees have 6+ chronic conditions that cost 50% of Medicare billing. If you can save money on those, it's perfect for them. And so when you're talking to employers, you say, hey, look, Medicare's doing this thing that I founded my entire practice on. And I've got way more latitude than a fee-for-service doctor to actually live these ideals. So here's MyMD Connect. I won't reiterate all of it because you heard directly from Jeremy himself earlier. Fantastic network down there in Texas. And he's telling me when we wrote the case study, he had the highest savings for employers on avoided ER visits and workers' comp cases he could handle, and his direct pay negotiated prices for services. Pretty much exactly what you heard in his talk. And he cited, when he talked to me, maybe because he was talking to me, but I hope it was genuine, that communication was a key in that. It increased access through patient app and texting. I got some quotes from him and Jay from when I talked to them. So I like the top one. Having a patient app has been really helpful, both in practice and the sales process. Very valuable tool. This part I love. I've got salespeople and brokers in meetings miles and miles away that will actually use their own apps to get in touch with our care team and demonstrate live to an employer why they should have us on board. Like, there are ways you can use any advanced communication. Doesn't have to be Spruce. Can be. Should be, probably. I love it. But it doesn't have to be. And that's right from Jeremy. And then Jay is making use of our asynchronous telemedicine. That's sort of bundling up questions into packs so you can save time on it. Very smart. This is the real stuff that you're not going to get in fee-for-service billing. You can do it here. So a quick Spruce announcement that might be of interest. If you like what Jeremy and other people were able to do with this network type stuff, we're going to hopefully support more of that. So we're going to support cross-org chat, hopefully very soon, where you can chat easily for care issues across organizations on Spruce. So you can bring specialists in your network, you can bring other local DPC docs in. That way, when you're putting together a pitch package for an employer, you can say it's not just your practice, it's you and 2 or 3 other people, so there's options for patients, you have connections seamlessly to specialist care networks. I don't want to belabor that because I don't want to make an advertisement, but I think the underlying point there is that getting into these loosely federated networks can be important for making attractive employer pitch packages. And this is just our way of trying to help with that. I think other platforms are investigating similar things. And then, if you liked anything you heard here, download a pack of essentials for improving your medical communication and winning DPC employer contracts. And that form that you hit if you go to that webpage is also acting as the beta sign-up if you're a Spruce customer already or want to be and want to test cross-org chat when it's available. Then hit that link, spruce.io/hint2018. And that was a little whirlwind tour of what I think about medical communication and how it relates to employer contracting.